Barrett's esophagus cancer risk and treatment. Barrett's esophagus is a condition that occurs when the normal lining of the esophagus, called squamous epithelium, is replaced by a different type of tissue called columnar epithelium. Columnar epithelium is typically found in the stomach and small intestine. What is Barrett's esophagus? Barrett's esophagus is a condition that occurs when the normal lining of the esophagus, called squamous epithelium, is replaced by a different type of tissue called columnar epithelium. Columnar epithelium is typically found in the stomach and small intestine. Causes. Barrett's esophagus is often the result of long-standing gastroesophageal reflux disease GERD, where stomach acid backs up into the esophagus, causing damage to the lining. People with chronic GERD are at a higher risk of developing Barrett's esophagus. Short segment Barrett's esophagus. Short segment Barrett's esophagus is a form of Barrett's esophagus where the abnormal tissue only appears in a short segment of the esophagus, often at the junction with the stomach. Cancer risk. Barrett's esophagus is a risk factor for esophageal cancer. The rate of cancerization of Barrett's esophagus is approximately 0.51 per year, but it can vary depending on several factors, including cancer risk. Length of the Barrett's segment. Long segment Barrett's esophagus has a higher risk than short segment Barrett's esophagus. Degree of tissue abnormality. The more severe the tissue abnormality, the higher the risk of cancer. Age. Older adults have a higher risk. Cancer risk. Family history. If you have a family history of esophageal cancer, your risk is also higher. Early detection. Early detection of Barrett's esophagus is crucial to manage the risk of cancer. Detection methods include esophagogastroduodenoscopy. EGD allows the doctor to directly examine the esophagus for abnormalities. Biopsy. Taking a tissue sample to examine under a microscope. Treatment. The main goals of Barrett's esophagus treatment are to control GERD and reduce the risk of cancer. Treatment methods include medications. Using medications to control stomach acid and reduce GERD symptoms. Treatment. Surgery. In some cases, surgery may be performed to repair the lower esophageal sphincter, preventing stomach acid from backing up into the esophagus. Surveillance. Regular surveillance with EGD and biopsies to detect early abnormalities. Curative treatment. Currently, there is no cure for Barrett's esophagus that can completely eliminate the risk of cancer. However, timely treatment and close monitoring can manage the condition and reduce the risk of cancer. Note: treatment and monitoring of Barrett's esophagus should be performed by a gastroenterologist. Treatment of Barrett's esophagus is a long-term process, requiring persistence and close collaboration between the patient and the doctor. Note: do not self-medicate or use any treatment methods without the advice of a doctor. Advice: if you have GERD symptoms, consult a doctor for diagnosis and timely treatment. If you are diagnosed with Barrett's esophagus, follow your doctor's instructions regarding treatment and regular monitoring. Maintain a healthy lifestyle, including advice: a healthy diet, limiting fatty, spicy, and fried foods, alcohol. Maintaining a healthy weight. Quitting smoking. Limiting alcohol consumption. A healthy diet, limiting fatty, spicy, and fried foods, alcohol. Maintaining a healthy weight. Advice: quitting smoking. Limiting alcohol consumption. Conclusion: Barrett's esophagus is a serious condition that can lead to cancer. However, early detection, timely treatment, and close monitoring can manage the risk of cancer and protect your health. Disclaimer: this article is for informational purposes only and should not be considered medical advice. Please consult with a doctor for diagnosis and appropriate treatment.